Hi guys, Dr. Heather Peterman here today. This video is really targeted for my acupuncture colleague friends. I wanted to talk to you guys a little bit about how we can be really helpful as we're coming back to work and coming back to opening our clinics and coming back to practices after the COVID-19 closures. I'm seeing some things since I've been back that I wanted to share with you, and I wanted to give you some language and some guidance about how you can approach things with your patients and other providers to really get people the help that they need. So it's a beautiful day outside. I'm actually at work in the oncology clinic today, but I'm on a lunch break. And I just took a little walk. We have a beautiful park outside, and I took a walk just to kind of process these stories that I'm hearing, because I've been back in the clinic for about 3 weeks now, and the stories that I'm hearing are absolutely tugging at my heartstrings, breaking my heart. And I wanted to take some time to honor that space of where my patients are coming from, but then also convert what they're telling me into a message that can be utilized to help other acupuncturists help patients navigate these issues. So what I'm hearing from my patients is that we've put people in a situation as a culture and as a nation where they've been removed from their social groups, and they've been removed and oftentimes from their, I'm going to let a car pass here. They've been removed from their support system, so their emotional well-being has really been compromised. And when I'm working with my oncology patients, I'm hearing them tell me that they haven't been able to be around their friends or their family or their loved ones because of the possible risk of exposure, even if their friends or families are symptomatic. They've been somewhat isolated at home, and they haven't really been able to express what they're going through or talk about their emotions or feelings with their loved ones, because their loved ones have so much on their plate dealing with the COVID-19 related issues. So these people are kind of starting to internalize, and when they start to internalize, they're starting to get sicker. They're starting to feel more pain. They're starting to feel physical symptoms because they're taking these emotions and they're not getting them out. That's specific to my oncology patient base, but I'm hearing that version of the story in different settings. I think that the issues that these closures have caused are pretty global and pretty universal as far as mental and emotional health. And I think that as acupuncturists, our best way to move forward and to help with this global pandemic is to focus on the emotional and psychological sequelae that's going to be created by COVID-19, that's going to be around for a very long time, because the world as we know it has truly changed. I see a lot of acupuncturists that are going back into work that are focusing on things like helping people build up their immune system and using formulas like jade windscreen to help people protect themselves and build their immunity and their lung qi. And I think that that's fabulous. There's absolutely a place for that, and it's needed, and we need to get that information out there. But if you're truly looking at trying to build your practice and get long-term patients, and really how can you give back at a maximum level, I think in addition to providing those preventive formulas and talking about how to build people's immune systems, we really need to focus on the mental health issues that are going to be created by all these closures. When we look at what happens with chronic pain, when we look at what happens with the disease process, all of that is so measurably impacted by our emotional well-being. So if we have somebody who already had back pain or knee pain or shoulder pain, and then during the time of the COVID closures, maybe they were scheduled for a procedure, or they were scheduled for a surgery, and that surgery or procedure got pushed back because we had to shut down these non-elective surgeries, so now their pain has been compounded. And then you add that to the stress level of not being able to work, potentially losing their job, losing their support systems, and you add all of those major stressors on top of what they were already experiencing as far as the symptoms, and you watch their cortisol levels climb and climb and climb. The inflammatory cascade is also going to go up higher and higher and higher. So it starts this negative feedback loop where people's conditions get worse, their pain levels get worse, their mental state, as it continues to deteriorate, and as their stress levels continue to climb, all of those physical symptoms become exacerbated. So really, to get to the root of what's going on, we need to address that mental and emotional well-being. And as acupuncturists, I think that I know that we can demonstrate that we can do that better than almost any other profession. Because right now with talk therapy, with any other cognitive behavioral therapies that a patient would go through, I don't know that people have the language that they need. I don't know that they have the ability to communicate truly what they're feeling, because this is such an unprecedented thing and it's not something that we can easily describe. But when we as acupuncturists go in to treat somebody, we can work on their emotional well-being, we can work on their Shen without them needing to really talk through what the issues are, and we can provide a release at a very spiritual level to help disrupt that inflammatory cascade. Now, my whole message to you guys is talking to you about how to communicate better with the Western staff and how to be able to kind of meld to increase your referrals. So that might sound kind of like flowery language coming from me when we talk about addressing Shen and being able to process. But when I deliver that message to physicians that I work with, the way that I deliver it is I tell physicians that, we all know that our mental well-being and our psychological well-being affects our physical well-being. They understand that. So I tell them that as an acupuncturist, when I come in, I address issues at the cellular level. So I allow people to process their emotions at the cellular level without needing to relive the trauma and without needing to have the language to talk through it, so that we can get their cortisol levels down, we can break the inflammatory cascade, and we can lower their pain, and we can stop physical symptoms from progressing. Physicians get that. They get that people have all kinds of underlying trauma. They get that people have all kinds of psych issues that are getting in the way, and so that's a really good way to be able to word that. Instead of going in and talking to the physicians like I was just talking to you and telling them how we're going to address the Shen, changing that dynamic and saying we're going to address trauma at the cellular level to allow people to better process their emotions and bring the cortisol levels down and stop the inflammatory cascade. I think and I know that this is going to be something that's going to be around for a long time. We're going to be dealing with the psychological sequelae from these closures for I don't know how long, but I wouldn't be surprised if it was the next decade. I'm seeing people that are introducing with new phobias, new fears. This is creating some pretty deep-seated stuff that I don't see going away, and that really makes me nervous to see what's going to happen to their physical well-being. So I feel like as acupuncturists, we need to unite in the message of coming across that we have a tool to address this. I'm not discrediting all the other physical things that we can do and all the other active benefits of acupuncturists, but if we can come together as a profession and get that message across that acupuncturists have a way to address the emotions on a cellular level and to help people process the trauma that they've been through in order to help increase their physical health and their emotional well-being, I think that is a really, really, really powerful tool that physicians need to hear and other providers need to hear, and that people in this country and in this world need to hear, so that we can really start to facilitate healing. And I think that gives us a really powerful message and a powerful in as the acupuncture community. So I just wanted to get this information out there. I wanted to ask you guys how you feel about it, and if this is something that you think that we should kind of unite together in our state organizations and our different organizations throughout the world to get this message out into the hands of the people that we want it to be in, so that we can really start to do something that creates a large movement and a large shift to help people heal from this trauma that we've been through. So that's about all I wanted to talk to you guys about today. Thanks for spending a little bit of time with me. You kept me company on my lunch break here, and I truly appreciate that. But if you like the message that I've been sharing with you, if you like the information that I'm giving you, and you like the direction that I go, or even if you're just picking out a few pearls here and there, please don't forget to like, share, and subscribe to my YouTube channel here at Doc Heather Peterman. And then also like me on Facebook, and don't forget I do have some PDA classes out there. I have new ones uploading every month, and you can find me at Purple Elephant PDA on Teachable.com. So thanks for sitting with me for a few minutes today, and please drop some comments. I'd love to hear what your thoughts are, and I'll see you in the next video. Bye-bye.